I want to bring in Dr. Kavita Patel. She's a former Obama White House policy director and an MSNBC medical contributor. So, Dr. Patel, just to sort of recap, if confirmed, RFK Jr. would have control over more than a dozen agencies and divisions. What do you believe the impact would be on American health care?
Yeah, Chris, I actually do think all the signals from today's Senate hearing and what I'm hearing around the Hills that he will get confirmed. So I think the impact is already devastating with what you've seen in executive orders and some of the kind of acting political people that they've put into place, even simple things like the Food and Drug Administration principal deputy that's acting, putting Making America Healthy Again on like the signature line for the Food and Drug Administration. So it's kind of inculcating a lot of the messages where you heard RFK come out strong. You could tell what he felt passionately about, not just vaccines and safety, but food and chronic disease, a theme over and over and over again. But then, Chris, he doesn't have the knowledge, and you don't need to. Nobody's going to expect somebody to come in and understand how 93,000 career staff and politicals operate every day. But you also saw like a lack of intellectual curiosity to kind of come back and say, what does that mean? You know, kind of an IMD, exclusion for behavioral health. Like, I'm interested in learning more. You heard just a little bit of that when he was in a corner. I would expect to see even more of that kind of, or less of that curiosity on steroids, which means the White House, the Office of Management and Budget are going to have such oversized, significant power that talking about the Secretary of HHS is not even as relevant as looking at the political appointees that are kind of around him. And that's where I would concentrate kind of what would happen next.
You know, you've worked on the inside, and we keep hearing the word disruptor. Obviously, that's something Donald Trump has used. That's what he wants. That's certainly what RFK is signaling he will be. Most Americans do generally believe government can run more efficiently, more effectively. But here's Elizabeth Warren expressing concern about Kennedy having the power that comes with being HHS secretary.
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just...
I'll commit to not taking any fees from drug companies while I'm secretary.
No, I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
no,
and I'm not going to agree to that,
drug
Senator.
Companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
There are a lot of people who support RFK who will see that as political questioning. Is it, or are those questions with real life implications for Americans?
No, they are. I mean, the tagline to Senator Warren's testimony or questions was kids might die, but Robert Kennedy can keep cashing in. And I think it really kind of crosses this line of not just conflict of interest, Chris, but what kind of message do we want to have somebody that has so much oversight on health really standing for? Is it really their personal interest? And I think that's what's so frustrating to people such as myself and probably like Dara, so many kind of like public health professionals. Like, there's this sense of, you know, Robert Kennedy's one of us. But when you look at kind of how he's made his money, what he's making his money on, he's not one of us. He's not leading with the science because he's cashing in on that very skepticism. I'm all for healthy debate. I think that's important. I don't think anybody's voices should be stifled. But when you have this kind of oversight, and he has enforcement authority, judicial all of the oversight and possibility. But again, I kind of point to this is just going to translate to more power for the White House, for some of these very concentrated areas of political appointees. And that in any administration is dangerous.
Writ large, there was a lot of belief in the first Trump administration that there were people who served as guardrails. Now, you've heard President Trump. If you want to work in this government, in this administration, you have to get on board with what we believe, what I believe. So I wonder, I'm sure you've had these conversations. If you're a scientist, you're a doctor, or anyone else, who believes that the mission at HHS is going to fundamentally change in a way that goes against what they believe? Do you stay inside and hope you can still have a positive impact? Or do you say, I can't function?
I feel like you're listening in on conversations I'm having with some of those very scientists who are, you know, career appointees, even thinking about being political appointees. Look, I've been through so many transitions of administrations, people on both sides of the aisle who want to serve. But to your point, Chris, they're being asked questions like, where do you stand on abortion? Where do you stand on transgender athletes? Where do you stand on transgender medical care? We've already seen White House orders and proclamations in these themes to date in just 1 week. So when you're being asked those questions and you're a scientist, a doctor with training such as mine, it is very hard to be able to say, yes, I will apply this one kind of litmus test. It's what we ask of Supreme Court nominees. Where do you stand on these issues? And they all say, we want to look at the law. In this case, you can't help but believe that you need to have the right answer or you're not going to be allowed, whether it's career or political. And you heard themes of that today. You heard that that's what the Biden administration did. That's simply not true, Chris, because we saw, not just in Biden, but in Obama, in Trump, in Bush, we've seen dissent inside of the administration. That produces healthy dialogue. That usually produces like a healthy relationship between the executive branch and the congressional branch and the judicial branch. This might be the first time, Chris, where I've seen kind of all three kind of pillars of our democracy kind of going through this litmus phrase, ending with, this is what President Trump thinks, ... You heard that today on abortion as well from RFK Jr.